Yeah, welcome to video series on lipids and lipids. Now this topic is important from exam point of view because these are the probable questions that will be asked. Classify prostaglandins, describe their functions, what are leukotrines, list their functions, and from patient point of view it has got a great clinical relevance, like why aspirin is used as antiplatelet drug, what's the significance of Ray's syndrome, and why steroids are responsible for acid ulcers or acid peptic disease. So let's uncover all these aspects in video. Now this is the overview of prostaglandin metabolism. Now the membrane phospholipids are acted upon by phospholipase A2 enzyme, releasing arachidonic acid from the membrane phospholipids. Now this arachidonic acid undergoes variety of pathway. Let's try to understand each one of this in detail. Arachidonic acid is acted upon by cyclooxygenase enzyme to form prostaglandin G2. Now this gets converted to prostaglandin H2. Now this is a precursor of all other prostaglandins. Now this prostaglandin H2 is acted upon by prostacyclin synthase to form prostacyclins, commonly known as prostaglandin I2. Now these prostacyclins are mainly responsible for platelet aggregation and vasodilatation. Okay, so this prostaglandin H2 is acted upon by thromboxane synthase enzyme to form thromboxane A2. Okay, now these thromboxanes are responsible for platelet aggregation and vasoconstriction. If you carefully observe this prostacyclin and thromboxane, the effects are in opposite direction. Thromboxane stimulates aggregation, platelet aggregation and vasoconstriction. Prostacyclins are responsible for inhibiting platelet aggregation and inhibiting vasoconstriction. So this prostaglandin H2 is acted upon by isomerase enzyme to form prostaglandin D2E2F2. All of this act by activating adenylate cyclase enzyme, which causes cyclization of ATP to cyclic AMP, and this causes activation of variety of protein kinase to bring about the metabolic effects, especially the lipolysis and glycogenesis. Apart from that, each individual prostaglandin, that is E2, D2, F2, have got other specific functions also. Okay, so this all of them, this D2, E2, F2, they are mediators of inflammation. Okay, that is common to all of this. Apart from that, they inhibit gastric secretion. Okay, so that is the reason why they are used in the treatment of acid peptic disease. All of this prostaglandin D2, E2, F2. Apart from that, E2 has got other clinical relevance, especially for obstetrics and gynecology, wherein prostaglandin E2, they bring about induction of labor in pregnant women. So they are also responsible for medical, they're used for medical termination of pregnancy. They are also used to arrest postpartum hemorrhage. So this you need to remember, especially the prostaglandin E2 analogs are bring about induction of labor, medical termination of pregnancy, and they are used for arresting postpartum hemorrhage. Okay, so apart from that, prostaglandin F2 has got a specific function of bronchodilation. Okay, so this was about prostaglandins. Here, one thing is of great clinical significance is that aspirin is a drug that is known to inhibit cyclooxygenase enzyme. Now, this aspirin is widely used as antiplatelet drug also. This is because now this aspirin irreversibly inhibits cyclooxygenase enzyme in platelets, so it prevents platelet aggregation, and this is widely used to prevent development of myocardial infarction, cerebral infarction and peripheral arterial disease, so that platelet aggregation and thrombus formation is prevented. So one thing you should know is this, however, the cyclooxygenase in the endothelial cells is not affected by aspirin. So this is affected only in platelets. That is why aspirin is also used as antiplatelet drug. One more clinical relevance you need to remember at this point of time is aspirin should not be given to children less than 12 years, or any adult also less than 18 years of age, because aspirin is known to precipitate Reyes syndrome. Now, what is this Reyes syndrome? Is whenever the children are recovering from any viral infection, so because of viral infection, their immunity is low, and the mitochondria and all the cell organelles mitochondria and all the cell organelles functioning of the mitochondria is reduced. So when aspirin is given, what happens? The aspirin gets converted to acetyl salicylic acid, and this can cause uncoupling of oxidation from phosphorylation in the mitochondria where ETC is located, and this will result in abnormal mitochondrial function or mitochondrial dysfunction. So especially in the hepatocytes, this mitochondrial dysfunction can affect all the metabolic process, decreasing the generation of ATP, and one more significant part that is affected is ammonia detoxification to urea is worstly affected, and the child can develop brain swelling and resulting in encephalopathy. So Reyes syndrome is characterized by acute fatty liver manifesting as hepatic failure and acute encephalopathy, mainly because of mitochondrial dysfunction induced by metabolites of aspirin. That's the reason why aspirin should be avoided to children below 12 years to prevent this Reyes syndrome. So let us try to let's understand the other pathway undergone by arachidonic acid. So this arachidonic acid is acted upon by lipoxygenase to form hydroperoxyicosate tetranoic acid, and from this leukotrine A4 is formed, and this can give rise to C4 and B4. B4 in turn give rise to leukotrine D4 and D4. Among this, leukotrine B4 acts as a chemotactic agent, and leukotrine C4, D4, E4 are responsible for anaphylaxis. They are slow reacting substances, and they bring about anaphylactic reaction, which is characterized by bronchoconstriction, that is constriction of the bronchioles of the lungs, vasoconstriction, constriction of the blood vessels in the entire body, smooth muscle contraction, and they mediate inflammation. Now, inflammation is characterized by calor, pallor, rubor, and dolor. So, in inflammation, how does this bring about inflammation? They increase the capillary permeability, causing leakage of the protein, which brings about swelling. So, and they also bring about vasodilatation, and this results in apart from swelling, there is redness, and there is pain also. So that is how this brings about the inflammation. Okay, so once this function is over, it is acted upon by peroxidase enzyme, and it will make these substances inactive. So this is lipooxygenase or leukotriene pathway. So the other one pathway is formation of lipoxins. Now arachidonic acid is acted upon by a lipoxygenase enzyme, and this results in the formation of lipoxins, especially the lipoxin A4. It acts as anti-inflammatory agents. Okay, so this was all about prostaglandins and leukotrienes and lipoxins and their clinical significance. So let's go for assessment mat. Prostaglandins are synthesized from arachidonic acid by phospholipase enzyme. Enzyme inhibited by aspirin is cyclooxygen. So aspirin inhibits cyclooxygenase mainly irreversibly in platelets but not in endothelial cells. A point you have. Which prostaglandin inhibits platelet aggregation? Prostaglandin I2. Thromboxane A2 mainly causes platelet aggregation. So prostacyclins and thromboxanes have opposite effect. Thromboxanes stimulate platelet aggregation and vasoconstriction. Prostacyclins, they bring about vasodilation and inhibit platelet. Okay, NSAIDs can cause gastric ulcer by they decrease the protective prostaglandins. Now, these prostaglandins are known to inhibit gastric secretion. Okay, so when we use non-steroidal anti-inflammatory drugs, so they will inhibit this prostaglandins, which are mediators of inflammation. So gastric protection is lost, and long-term use of this NSAIDs is associated with development of gastric ulcer. So that's the reason we should not prescribe this NSAIDs for a very Okay, which prostaglandin is used to induce labor? E2 series. They are used to not only to induce labor, they are also used for medical termination of pregnancy and to arrest postpartum marriage. Leukotrines are produced through lipoxygenase. Which of the following causes bronchoconstriction? It is leukotrines. Bronchodilation is brought about by prostaglandin F2. That you need to remember. Okay, leukotrines are mainly responsible. They act as slow reacting substances and they bring about anaphylaxis. Bronchoconstriction is one of the reactions of anaphylaxis. The immediate precursor of prostaglandin is H2. H2 is a precursor of all the prostaglandins D2, E2, F2 and also prostacyclins. Which enzyme releases arachidonic acid from membrane phospholipids? It is phospholipase. Okay, corticosteroids reduce prostaglandin synthesis by inhibiting phospholipase A2. So that's the reason too much steroids act as anti-inflammatory agents because they inhibit this phospholipase A2. So there is no synthesis of prostaglandins, which are actually mediators of inflammation. So which prostaglandin causes vasodilation and inhibit platelet aggregation? It is prostacyclin or prostaglandin. So this was all about prostaglandins, leukotrienes. So check out your MCQ score. If it is more than 50% good, less than 50%, redo the entire session. So thank you for watching. If you like the video, please do like, share and subscribe. So this was all about the video series on lipid metabolism. So please do watch the entire series to get a comprehensive picture of the lipid metabolism. So next we will start video series on carbohydrate metabolism. Thank you. Happy learning.